Welcome back. Cabinet to dedicate an entire day to discussing the whole hot button issue of legalizing marijuana before any movement is made in this regard. Press Secretary Anthony Newbold revealing as much to reporters just days after a CARICOM-led town meeting saw widespread support for the ever-popular drug to get the green light here in the Bahamas.
The Prime Minister says always, and he continues to emphasize this, the Bahamian, whatever happens, the Bahamian people must have a say in what that final decision, whatever that final determination is. It will be made after the Bahamian people have had an opportunity to weigh in extensively on that issue, just like any other.
Friday's town meeting was in keeping with the CARICOM Regional Commission's mandate to get public opinion in member countries on the issue. The commission's expected to present its full report from across the region to the heads of government in July. In other news this evening, the hemorrhaging in the healthcare profession continues, leaving the industry handicapped. Our Jillian Gray explains in this report.
The public sector is losing nurses at a rapid rate. Severe understaffing has led to 4 intensive care beds being shut down this week alone, a sad state of affairs that Health Minister Dr. Dwayne Sands admits is serious.
It is absolutely critical. And so the implications are that there are Bahamian patients who would wish to be in the intensive care unit, but they cannot be in the intensive care unit because we simply do not have the manpower, the nursing support to care for them safely in the ICU.
The situation has even forced officials to outsource nursing staff. Now, the minister accepts it's not the ideal situation, but all things considered, it's what must be done.
Our preference would be to staff our critical care areas with Bahamian personnel, Bahamian experts. But as rapidly as we train nurses, we lose nurses either to North America, to retirement, or to the private sector. And what it means, I believe, is that we have to look at nurses separate and apart from many of the other professions. Now, I know that that will be very controversial, but the implications have life and death implications for our people.
The big question is, what's being done to turn things around?
The conversation has started, and what we are looking to do is to see how we can modify the terms of engagement of nurses, how we can demonstrate more appreciation for what they do. Clearly, that has service implications. It may mean that we look at the way we deploy nurses. They're currently deployed in what we call a 4-on, 4-off rotation. That has implications for time and reimbursement. We may speak to the nursing union and to the nurses and say, hey, perhaps if we modify that, there could be some advantages for nursing. We also want to look realistically at what sustainable options there are to improve the conditions of nurses so that we're not losing 60, 70 nurses per year to the United States.
Late last year, the number of nurses leaving the country stood at well over 800. For JCN News, I'm Jillian Gray.
Also on health news, the National Insurance Board has missed its deadline to submit a crucial report. That report would suggest various recommendations, including the introduction of a new tax to fund the multi-million-dollar National Health Insurance Scheme.
We are 9 days past the end of the year, so trust me, I'm putting the pressure on my very competent, hard-working NHI board to come to the public and say, this is what we are going to do. They've had some challenges. They were waiting for that very, very important opinion from the Attorney General's office. I would have had direct conversation with the Attorney General, so he would have said what is going to be in that report. but we still need to have the physical report for the board.
Roughly $15 million each was initially budgeted for NHI's primary and catastrophic healthcare phases, and another $10 million just to run the program. However, this fiscal year, that budget was slashed by 10% to about $36 million. And this is exactly why talk of a new tax is becoming more and more of a reality.
Paying for it means that because we are running a fiscal deficit and have been doing so every year since 1971, 72, that any new benefit, we need to figure out where the money is going to come from. And it's going to mean that the Bahamian people are going to have to dig deep and find the funds. But what we have promised is that we are going to eliminate a lot of the waste in healthcare so that they get value for money.
At last count, nearly 30,000 people were benefiting from NHI daily. You're watching JCN News. There's more when we return.
This segment of the news was brought to you by Alive.